Hi everyone, my name is Olivia Ruppel. I am a student at East Stroudsburg University. I'm a senior, majoring in communication sciences and disorders. I worked on this presentation with Dr. Susan Delmuth Miller, and my thesis was on mental health in persons with hearing loss. Mental illness is defined as a broad range of medical conditions that affect the way the brain organizes thoughts, emotions, behaviors, and personality. This can interrupt psychological functioning, cause significant distress, and in extreme cases, it can even cause physical ailments. Approximately 40% of the deaf population suffer from a mental illness, which is compared to about 25% of the general population. And my thesis discussed a lot of why that gap exists and what we can do to help. Some reasons that the gap exists include language barrier and feelings that they don't belong in either the deaf community or the hearing community. Some treatment barriers, as I said before, the language barrier and not feeling like they belong in either community. There are additional treatment barriers that exist. The deaf client feels that sometimes they can't disclose what's going on with them when there's an interpreter in the room. It eliminates a level of trust between the client and the doctor or the practitioner. And in some cases, the patient may actually know the interpreter personally. Sometimes the deaf community in one area can be very small, so they've either known the interpreter in other events they've gone to, or they may know their parent or sibling. So they may not feel comfortable disclosing what's going on with their mental illness or their physical illness with the interpreter in the room. And another treatment barrier is that not every English word has a sign language counterpart. So that means that there may be miscommunication, mistranslations, there could be a disconnect, and this could lead to misdiagnoses or confusion between the patient or confusion about what's going on with them. Mental health and abuse concerns in the deaf population. So a study by Crisis Text Line found that depression increases in deaf individuals by about 16% compared to the general population. Anxiety disorders can increase by 3 times in persons with hearing loss. About 20.6% of men and 37.8% of deaf women reported having been sexually assaulted, while 73.5% of men and 71.1% of women reported being physically assaulted. These are deaf men and women. And 50 to 54% of deaf children reported being sexually abused, compared to 10 to 25% of hearing children. So that's a big gap. This is just a little chart that I made to compare suicidal ideations, OCD, and suicide attempts between hearing and the deaf. So deaf experience OCD, according to this study, 7.8% of the time, while general population experience it 0.5% of the time. Suicidal ideations, the deaf population experience it 44% of the time, while the general population only 12%. And suicide attempts, deaf persons experience it 18% of the time, while the general population 1.3%. Biological factors. So this was a study conducted with mice with vestibular dysfunction. So vestibular dysfunction, for those of you who don't know, is it's dysfunction in the balancing processes of the inner ear. And this can occur in deaf people because of the inner ear functions. So the study of mice compared mice with vestibular dysfunction with mice who are deaf without vestibular dysfunction. And it was found that there are higher rates of attention deficit hyperactivity disorder, or ADHD, and anxiety disorders. In the same study, it was found that the mice with vestibular abnormalities displayed anxiety-related behavior more often than those without. And as many as 82% of hearing impaired children also have vestibular dysfunction. So there could be biological factors between these anxiety disorders and vestibular dysfunction, or ADHD and vestibular dysfunction. And anxiety disorder. So anxiety disorder is an umbrella term that is used to describe multiple disorders that involve excessive and, in extreme cases, constant consternation as a dominant feature. Deaf individuals are at a higher risk for developing anxiety disorders due to their lack of awareness of their surroundings, their social anxieties, and the fact that the older deaf population may have been sent to deaf schools as children, so they feel separation anxiety from those who are close to them. Some physical symptoms of anxiety disorders include excessive sweating, nausea, vomiting, dizziness, chest pain, choking sensation, palpitations, and numbness. Some examples of anxiety disorders include generalized anxiety disorder, social anxiety disorder, and separation anxiety disorder, all of which occur at a higher rate in the deaf population compared to the hearing population. Depression. Depression is a mood disorder that is characterized by sadness, inactivity, difficulty concentrating, troubles with eating, sleeping, and feelings of hopelessness. Social isolation can be a contributing factor to the high numbers of depression in deaf compared to hearing persons. The number of people who feel isolated doubles in the deaf population compared to the general or hearing population. Deaf individuals are 4 times more likely to be unemployed, and it is found that prolonged unemployment is likely linked to depression. Employers can discriminate against deaf individuals because they may feel that they're unable financially to cater to their needs. And also it's found that employers may feel that deaf individuals aren't as qualified or educated to complete the job that they're hired to do. Deaf and hard of hearing individuals are also not given the same educational opportunities compared with the general population. Sometimes in classrooms, the deaf children can't hear the teacher speak. And although the child can hear when the classroom is quiet, a lot of classrooms are not always quiet. So the deaf child may be distracted by the noises that are closer than the teacher, the children's talking around them, can create an environment that is very hard to learn for a deaf child. The number of deaf students in higher education is actually declining, which means they're not finishing their education, and employment opportunities are also declining for the deaf as well. Drug and alcohol dependency or abuse. There are approximately 600,000 individuals who experience alcoholism and are hard of hearing, and it is estimated that those numbers are higher, that there are higher numbers of deaf alcoholics compared to hearing alcoholics. Deaf and hard of hearing individuals often feel bound by their situation. They feel trapped, and they feel that they need to find a form of escapism. This is why they usually turn to drugs or alcohol to help them escape from their situation. They feel frustrated by their isolation, and the drugs and alcohol help relieve that. Drug and alcohol dependency can lead to liver damage, memory loss, certain forms of cancer, heightened blood pressure, bone pain, and problems swallowing or dysphagia. So the fact that deaf people struggle with this at a higher rate can have a physical consequence in addition to the emotional or mental consequence. Post-traumatic stress disorder, or PTSD. PTSD is defined as a reaction by the brain after experiencing an extremely stressful event. It is characterized by depression, anxiety, flashbacks, nightmares, and avoidance of triggers or triggering events. Veterans often experience PTSD due to the fact that they may see people die in war, or they see explosions, or they have killed people themselves. And it is found that 43.2% of veterans suffer from hearing loss. And this can also create a very dangerous situation for them being deaf and suffering from PTSD, because when you start to disassociate, they can wander off and they don't know where they are. And when you're deaf, that can be extremely distressing, and they don't know how to find their way back home, and they can't always ask for help from the people around them. Additionally, deaf and hard of hearing people are assaulted at higher rates due to their vulnerability, and they may not be able to speak out, or people may not believe them. Obsessive compulsive disorder, or OCD. It is defined as a mental disorder that is characterized by obsessions, compulsions, or both, and they reoccur uncontrollably. It can cause significant distress, and it can cause you to be late to events or late for work. And it can cause social distress as well. It takes up a great deal of time and interrupts daily functioning. And the obsessions or compulsions are typically unreasonable, excessive, or irrational to everyone except the person feeling them. Deaf children are often obsessed with schedules, as they are often unaware of the world around them. They feel that becoming obsessed with schedules can help get some control over their lives. This can lead to a person checking or asking about a schedule 40 to 50 times a day, which that's excessive. Some deaf children have the compulsion of repetition due to the extreme effort and repetition it takes to learn sign language. And that's where they believe that it is traced back to. Additionally, there's a serious lack of information out there for OCD and comorbidity with deafness, which it decreases the likelihood of someone seeking for help, and it decreases the education surrounding it. So OCD specific therapists or doctors may not know how to help a deaf person as well. Suicide. So longer lasting mental health issues can eventually lead to drug addiction, alcoholism, violence, and suicide. A study conducted at the University of Rochester concluded that only 31% of schools have a protocol for deaf suicide situations. And the same study found that most of these protocols were entirely administrative. So that means that they may not receive the help that they really need. They might just be forced to go to counseling, but the counselors may not be trained to help them specifically. Some risk factors that a person may be considering suicide include a mental illness, a history of trauma or abuse, past suicide attempts, job or financial loss, and the list goes on. And some warning signs include talking about death or killing themselves, researching ways to carry out their plan, talking about feelings of hopelessness, increasing use of drugs or alcohol, and giving away prized possessions. So my conclusion, some things that can be done to decrease this gap are stigma erasure. So just education and releasing the stigma off of mental illness and making it less taboo of a subject to talk about. And more people who work with deaf and hard of hearing individuals should work to increase their awareness of the warning signs and risk factors that indicate a person may be considering taking their own life, or risk factors that a person may be in need of help. Professionals who work with deaf and hard of hearing persons should also familiarize themselves with signs and symptoms of mental disorders and look out for them when they're working with their clients. Physicians and teachers of deaf and hard of hearing children should inform the parents or guardians of the risks of some signs and symptoms to look out for. And specialized training for professionals and parents on how to help someone in need could help as well. So these are just some ideas that I had to decrease the gap between the general population and the deaf when it comes to mental illness. If you have any questions, you can reach out to me. My email is oruppel@live.esu.edu. You can see my email at the bottom. And thank you so much for watching my presentation.